Thank you for joining us in the next video that we're doing in the series of information for men that are receiving hormone therapy for prostate cancer. My name is Louise Field and I am the founder of Adore Your Pelvic Floor. And I'm joined today with Rebecca McDonald. She's a PT, an exercise physiologist, a pelvic floor and health coach. She also is a nutritional therapist and also works in rehabilitation for long COVID. And she is also a rehabilitation assistant alongside James McDonald for the body coaches in Medway. Now, today we are going to be talking about the effects of hormone therapy on cardiovascular health. So thank you very much for joining us, Rebecca.
Hello, thank you for having me, Louise. It's been an absolute pleasure to be invited on to do this and reach out and help people with a diagnosis of prostate cancer. So thank you so much for having me on.
Well, we really appreciate your expert advice as well. And I know that you've been filming exercise videos as a library of other information videos for local cancer rehabilitation to help increase the rates of recovery. You've also been launching a project to help the elderly with their mobility and social activity and mental health. You're a busy lady.
Anything I can do to help one individual is a job done. So that's my thing. If I've helped one person a day, my job is done. And that is it. Hopefully we're reaching more people, but one person a day. If I've helped one person every single day, then obviously I'm doing my work well.
Oh, my darling, thank you so much. So with regards to hormone therapy, what are the effects on cardiovascular health?
So the hormone therapy for prostate cancer is ADT. So it's the androgen deprivation therapy, okay? And basically, the androgen is the testosterone hormone, okay? So effectively, whilst you're taking that, the testosterone drops in the body. Now, there's a lot of effects, obviously, to reduce testosterone in the body. It has an effect on metabolism. So obviously, it starts slowing everything down. It causes higher increased cholesterol. So as that metabolism slows down, you can have increased cholesterol in your system. That increased cholesterol then contributes towards plaque buildup in your arteries as well, which then has a knock onto your cardiovascular health. Your blood pressure as well will heighten as the blood is trying to push through the artery walls, and it causes that increased pressure in the artery walls. Bone mass, so your bone mass depletes as well. So as testosterone drops, so does your bone mass and your muscle mass. So we all rely on a certain amount of testosterone to keep our bodies ticking and flowing through really nicely. It can increase the chance of diabetes as well. And obviously all of this together affects our cardiovascular health. So all in all, that system starts to essentially what we'd say will decline. But there are things that you can do to prevent that from happening. And that's exactly why I'm here.
That's really, really good to hear. So is there like an exercise prescription? Is there any guidelines here?
There is. There is a main source of guideline, and this is from Rehab. So it is specialised advice that we have to follow. The first one, when it comes down to exercising, is overload. Now, most of us associate with overload as in overloading the body in a negative way, but this overload is different. We need to overload the body in a more positive way. So whatever you're currently doing health-wise, you just need to push it that little bit more. Okay, we're not going to see any effects if you continue doing what you're doing. So what you need to do is just push it that little bit more. Now, I don't expect you to go from, you know, a 1 mile walk to a marathon. That's not what I'm saying. It's about making that small step. So if you regularly go for a daily mile, as an example, why don't you try going for a daily 1.5 miles? So that's what we mean by overload. Wherever you are currently in your fitness levels, to try and help with the hormone treatment is to just push it that little bit more. Okay, and that's the overload. So that's the first principle, is wherever you are now, push it that little bit further. Okay, so whether or not that's how often you exercise, so if you swim once a week, go swimming twice a week, and it's about pushing yourself that little bit more. Or a duration, so if you like walking or running, just see if you can go for 5-10 minutes more, maybe even half an hour. And if you enjoy strength training, which does come into your cardiovascular health as well, wherever you are, whether or not you're working in the gym or you're working out at home and you're working with a weight, try increasing it. Okay, not so much to cause fatigue, but just that little bit more, so you can stick to the same workout regime, you're just picking up that little bit more.
I take it that, oh, sorry, didn't mean to.
Go on.
I take it that you should still feel good at the end of the session.
The main thing here is what we recommend is energize, not exhaust. Okay, that is a really, really important phrase that we have, is energize, not exhaust. You should feel energized after your workout, not absolutely exhausted.
Brilliant, brilliant. That's lovely. So how do we choose suitable exercise?
Well, the other one that you need to think about with like the principles is that when we're working with, especially when we're working with cancer patients, the exercises also need to be specific. So they have to be specific to you and what you need to achieve as an outcome. So obviously with prostate cancer, a hormone therapy treatment, we need to be focusing on that cardiovascular health. So that cardiovascular health, what would be specific for prostate is increasing that cardio, as well as including your strength training, because strength training goes a long way as well. So that is your specific. So that is another principle. The other one is adaptation. So I know you said previously about not exhausting the body. Adaptation is the principle where your body doesn't benefit as you are working out. So as an example, yes, you could be on a spin bike, you could be doing, but your body doesn't adapt until after that workout. That's when those changes happen. And if you keep piling on top of that and on top of that, you're not allowing enough rest for your body to make that adaptation. So again, you've got to exercise, but you've also got to allow for your rest points as well and allow the body to adapt. Another one that is really, really important is reversibility. Okay. And I don't know about you, Louise, but I have so many clients like this where one workout a week, say, for example, they come along Monday class, and then they'll come along to the following Monday class, but they're not doing anything in between. And essentially what happens is your body does a reset. So this is why one session a week isn't going to benefit you. You need to be able to, say, for example, work out on a Monday, have a rest day on a Tuesday, pop in something else on a Wednesday, maybe allow Thursday for a rest period, but you have to work with your own body. So just remembering that the body can reverse back. So you may have a flat out week and you might be doing really well and then take 2 weeks off. You're undoing all the work that you've just done. So reversibility, don't forget that as well. And finally, this is where the exercise suited to you is your own modification. Now, unfortunately, there's not one exercise prescription that will suit everyone. Everyone has different backgrounds, everyone has different levels of health, everyone is individual. So when we start thinking about adaptation, it's about if your body starts to feel tired on the exercise plan that you are doing, then you need to adapt it, because we can't have you feeling tired, because if you're feeling tired, what's going to happen is you're going to take a longer period of time off because you're exhausting, and then you have that reversibility effect. And then you're starting from that square one again. So you have to adapt it to how it suits you. So whether or not that's changing your duration, whether or not that's dropping the weight down. And we always say that rest days, when we talk about rest days, there are going to be times, unfortunately, with cancer, a side effect is fatigue. So you need to take that fatigue and not push yourself to do anything. You may want to push against any hormone treatment that you're having but essentially you also need to allow your body rest and recover. So on those rest days, why not go for a stretch session? On those rest days, why not just go for a quick walk around the block? Those days when you're not feeling that workout. And that's where you need to learn to adapt to any treatment that you're having and any side effects that you're having. Choosing the right exercise.
Sorry, yeah, so it's having consistency, but listening to your body on how you feel that day. And something very small is worth doing because that just keeps the mojo going.
Yeah, it keeps everything going. And it also, on the flip side of the mental health, how often do we beat ourselves up because we were unable to do something that day? And that's really, really important. Okay, so maybe you didn't quite get to swimming, but you went for a walk around the block. You've still achieved something. Maybe you didn't get to go to your Pilates class, but you stayed at home and you done a nice gentle stretching session. So it's that consistency is key, but not to push your body too much, and take the rest when it is needed.
Lovely. That's really, really lovely. So the benefits of moving with cancer.
Do you know what? There is something that is prevalent above all of this. Exercise has no downsides. It has no downsides whatsoever, okay? No matter what you might be fighting at the time, exercise will only benefit you, okay? And that is it. It will only benefit. Everything that you are doing, exercise is shown to improve. It was only last week that I was reading a study. It was a study in Australia, and it was actually on men who was going through hormone treatment for prostate cancer. And what they done is they took their group, they divided their group. Just prior, some were just prior, some were as the hormone therapy treatment started, set them off for exercise. The other group went 6 months after the hormone therapy had started. And what they found in the study, that the ones that started as soon as they had their diagnosis, or as soon as the hormone treatment had started, showed no drop in cardiovascular health, fitness, bone mass, muscle mass. So there is a really, really positive outcome. Now, the ones that obviously didn't, so they done 6 months without any exercise, yes, they had dropped. But the good news is that when they started, they came back up to level. So it doesn't matter when you start, okay, as long as you are doing something and it's that little bit more than you may have been doing before. So what we say is that overload. And again, just that consistency when you can, remembering that we don't want to be reversing anything that we've already done, that we're adapting to how we're feeling and how we're coping with things. If one of the things that I will say is, if you don't know what to do with regards to your exercise, go and see a specialist, okay? Specifically a cancer rehabilitation specialist. Even though you may not be rehabilitating, they're also qualified to do pre-habilitation as well, so during your treatment. So always see a specialist when it comes down to your exercise, but there is no negatives to doing exercise when you're going through any form of treatment. It's always been proven to show some really good positive outcomes.
That's a wonderful way to finish on. I love that study. I think that is fantastic news, isn't it?
It really is.
Yeah. I'm just trying to think of the best way people can find a rehab trainer. Is there anywhere that they could they go to their hospital and get a list, or is there?
Yeah, well done, Lou. There is basically attached to most trusts. So prehab has recently exploded, okay? And many people, with all the studies that have been done recently, specifically with cancer patients, that they have the trials and all the research that has been out there has shown huge effects that exercise can have. So as a result, the NHS trusts, so a lot of individual trusts in your area most probably have already got a pre-habilitation program attached. So it's not just for cancer patients. It's been proven that people that exercise prior to any surgery have better outcomes afterwards as well. So there is a lot of prehab programs, which are your pre-habilitation programs, popping up everywhere in all sorts of trusts, which is absolutely amazing news. So chances are, if you speak to your cancer care team or your cancer specialist, then they will most probably be able to refer you over to go and speak to that specialist.
Brilliant. That is what I like to hear. That is amazing. Rebecca, we really appreciate your time. Is there anything that we haven't covered that you felt like you needed to mention?
There are some contraindications to exercise. You know, when you wrote a list and you've got no idea what you've done with it.
Yeah.
The contraindications to exercise, I will try and remember off the top of my head, because there are a few of them. And that is if you're going through any treatment, if your blood count is low or any treatment has been delayed, they do advise not to exercise. Other ones are any peculiar rashes, changes to the body. Again, go and see your cancer care team. All of these are just go and see your cancer care team. Blood pressure. What other ones were on the list? There was
You're on the spot.
There's
Sorry.
so many, but I can always attach one to the video as well. Obviously, any sudden headaches, onset of headaches or migraines is another one. Don't exercise. Any sudden joint pain or swelling, aching, again, can be a side effect of treatment, but they do advise go and see your cancer care team before you take on any more exercise. And this is where a pre-habilitation program attached to an NHS is so handy, because you will be assigned an exercise physiologist who will be on hand at all times. Well, you know, they can give that advice. Do I take that Pilates? Do I do that Pilates session? And they will say, actually, no, probably take a day off. Or, do you know what? Yes, of course, go for it. It's just a side effect of this. So make sure that you are always in touch with your cancer care specialist as well. And finally, exercise can be pushed on so many people, and ultimately we want you to enjoy it. There's always an exercise, something out there for everyone. As you will probably agree, Louise, it's that if you like to dance, take up Zumba. If you like stretch and tone, yoga, Pilates. If you enjoy walking, there's probably lots of walking groups in your area, so you can go and socialise as well, rather than just taking yourself out for a walk. Drag your family on board, drag your friends on board. Swimming is so good for strength training and overall cardiovascular health as well. So go and join your swimming pool, whatever it is that if you like ballet, as it, for example. So if you've had a past of ballet and you think, what if I could get back to that? You've got barre. So there might be some barre classes in your area. So there's always something for everyone. Don't see exercise as a chore. And one of the other things that popped into my head last night was dancing. I tell you something, dance around your house.
Yeah, I as you were talking, I was thinking of the dancing, because I've been talking today and last week as well of people that I'm teaching that have joined rock and roll classes and the jive, and they are absolutely buzzing. And in fact, this morning one of them said, I didn't get home till midnight last night because we were doing it for 3 hours. But dancing around your house is exactly the point. Yeah, it gives you the feel good factor as well, doesn't it? And
yeah,
it's all part of it. It's all part of exercise.
And that leads me on to my other point is, obviously us professionals, we have what we call a rate of perceived exertion. So you have that RPE scale that people should be working to. And when we're working with anyone, whilst you're exercising, you should be able to talk but not be able to sing. Okay, that's our thing. So while you're dancing around the house, if you can sing, you're not dancing hard enough.
I never know the words properly. Oh, Rebecca, that is so helpful. And we are hoping that this will reach many, many health platforms, many men. We actually do have a strength and conditioning video coming on, and we also have one for joint health. So we are covering exercise beautifully, and thank you for your part in this.
Thank you for inviting me, Louise. It has been an absolute pleasure. And if I can help any more in any way, or anyone, please reach out and let me know.
Oh, thank you. Well, your contact details will be in the description attached to the YouTube video. So thank you very kindly, and see you soon. Bye-bye.
Bye-bye.